Hello and welcome back to another episode of Rhinoplasty series. Nose surgery patients often ask about what to do and what not to do during the recovery period after surgery. What follows is a list of do's and don'ts for rhinoplasty recovery. Stay tuned. Do's after rhinoplasty. Do take a lot of deep breaths right after operation, along with wiggling your toes occasionally in bed and walking around a bit. All of these actions can help keep your circulation going and avoid blood clots. Do give yourself considerable time away from work or school during recovery time. You should be able to return to your usual activities after 2 to 3 weeks. One of the useful things you can do in the first weeks following a nose job is to simply relax. Use the recovery time to catch up on a few movies, books, or TV shows. Do continue to avoid smoking. Smoking is dangerous because it will interfere with the safety of the operation and can negatively affect the final results. Nicotine slows down blood flows, which could make you more likely to scar. The drug also disrupts healing. Generally, surgeons advise preventing smoking for at least another 2 weeks after your nose job. Do remain your head elevated as much as possible following surgery. This means sleeping with 2 pillows at night. The elevation of your head can help bring down swelling. Do remove the dressing under the nose on the day following your surgery and wash inside the nose at least 5 times a day with the washing solution and syringe provided to you, and apply ointment to the sutured area 3 times a day. Do apply a cold compress on the nose and eyes for the first 48 hours after your surgery. Then use a warm compress for another 48 hours. Do not press the compress too hard on the nose. Do brush your teeth gently with a soft brush for some time after surgery. Do follow the instructions. Your doctor will give you a list of pre- and post-operative instructions. These instructions are crucial to your roadmap to a successful recovery, and there are no shortcuts. Take it, read it, live it. Don'ts after rhinoplasty. Don't lift heavy objects or even overexert yourself with tasks such as heavy housework. Though taking light walk is a good idea starting about a day or following your operation. You should stay out of the gym and prevent any strenuous exercise for at least a month. Any activities that include injury to your nose potentially, such as tennis, baseball, soccer, should be prevented for about 6 months or until your doctor gives you the all clear. Don't take any medicine without your doctor's approval. Do take any antihistamine or pain medication as needed, but try to replace pain meds with Tylenol immediately. If you enjoy your private bathroom time, you will want to wean yourself off of pain meds as soon as possible, as they can cause constipation. Some surgeons suggest avoiding aspirin or anti-inflammatory medicines, including ibuprofen, for at least 2 weeks before and after the operation. Alcohol is also prohibited for at least 2 weeks after surgery. Don't wear pullover clothes, t-shirts, and other clothes that need to be pulled over your head for 2 weeks after surgery. Don't wash your face during the first week, as the spleen might get wet. A wet spleen causes rash and infection. Dry it with a hair dryer if it gets wet. Washing your body is permitted. There is no cheating recovery, no matter how eager you are to include every beach in a split on your grid. Traveling on a plane too early will not only take you away from your patient advisor and doctor, but you can also increase the risk of sinus blockage. Don't wear eyeglasses, medical glasses, or sunglasses for 3 months after surgery, as the nose pads can pressure the nose and hinder the healing or the nasal bones. If you have to wear them, tape them to your forehead so that they won't pressure your nasal bones. Contact lenses are permitted after 2 to 3 days. Don't expose yourself to intense sunlight for 6 months. Sunlight causes inflammation in your nose. Don't sneeze or blow your nose for a couple of weeks. Sneezing might affect some people after surgery. Sneeze with an open mouth so that no pressure is put on your nose. Don't drive for 1 to 2 weeks after surgery. Don't have sexual intercourse for 10 days after surgery. Also, any adrenaline rush activities such as masturbation should be refrained from during the first 2 weeks, as they cause inflammation in the nose and sometimes bleeding. Don't laugh out loud and make extreme facial movements for 1 week. Don't make any judgments about the results of your nose surgery until at least 6 months after the surgery, as it takes time for the swelling to fade away to the extent that you could see the results. It takes at least 12 to 18 months for the nose to take its real shape. Sometimes the improvement process continues up to 3 years after the surgery. Following all these points will definitely help you avoid some common complications and side effects that may affect the outcome of the operation. Feel free to ask any questions you have in the comments below, and don't forget to subscribe to our channel by clicking this button here. Thanks for watching us. Bye for now.